Welcome to the Deep Dive. Today we're embarking on a deep dive that, well, it might just challenge your fundamental assumptions about the recent pandemic.
Mm-hmm.
We all remember that feeling, right? That widespread sense that something went profoundly wrong.
Yeah, absolutely.
But what if, and this is according to one author, what if much of what we experience wasn't just a series of mistakes, but an intentional redirection, one leading to massive widespread pain and even death?
It's a powerful premise, definitely controversial, and that's exactly what we're exploring today. Our mission here is to unpack a very specific viewpoint from the book Pandemic Blunder by Joel S. Hirschhorn.
Right.
He argues that government agencies, public health systems, they deliberately blocked early home COVID treatment.
Right.
And we need to be really clear up front. We're not here to endorse this view. Our goal is to understand the claims, the insights the author brings forward. Many of these might be aspects of the response you haven't really encountered before.
That's crucial to keep in mind, yeah. So setting the stage a bit more. The author, Dr. Hirschhorn, he's affiliated with groups like the Association of American Physicians and Surgeons, America's frontline doctors.
Mm-hmm.
And he makes a really stark claim in the book that the mismanagement of the pandemic, from his viewpoint, actually amounts to a crime against humanity. That's an incredibly serious accusation.
It is, and the book really dedicates itself to trying to substantiate that. That's what we'll delve into. The author defines what he calls an astronomical blunder.
Astronomical blunder. Okay.
Yeah, meaning an intentional action, he argues, with just enormous, adverse, irreversible consequences. So we'll look at the specific criticisms he levels against public health officials, agencies like NIH, CDC, FDA.
Right, the big ones.
Exactly, and even parts of the media, the pharmaceutical industry. But just as importantly, we'll look at the case the book makes for those early treatments it champions.
Okay, so let's unpack that core idea first. The astronomical blunder. The author isn't saying it was just an accident. He calls it an intentional action that led to, in his words, criminally negligent homicide. Wow. How does the book start to build that case?
Well, it points fingers directly at federal agencies, NIH, CDC, FDA, and what it calls their allies. This includes groups the author labels as leftist media, academics, medical societies, drug companies, politicians. Basically, a whole network allegedly shaping this blunder. And it asks, was it just bureaucratic incompetence or was there actual evil intent? The author concludes, given the human cost as he sees it, it leans more towards intent.
And this is where it gets really striking. The book actually argues that the idea that the COVID infection has created a genuine crisis should be seen more as propaganda than a medical reality. It talks about a disinformation pandemic.
Right. Suggesting a deliberate manipulation of public perception, where the crisis itself was kind of distorted to achieve certain goals impacting society, the economy.
Which immediately brings up basic medical principles, doesn't it? The book talks about a forgotten medical imperative, early action.
Exactly. The whole first do no harm idea.
Yeah.
Traditional medicine emphasizes diagnosing and treating as early as possible. I mean, patients expect to be kept out of the hospital, right? That's always the last resort.
Of course. And the book quotes Dr. Jean-Jacques Rocher saying, basically, look at other diseases we know intervening early leads to better outcomes.
Yeah, he suggests early treatment could massively reduce hospitalizations, ease the burden on the system.
So the book outlines COVID's progression, viral replication, then maybe pneumonia, then potentially multi-organ issues.
And the author's core point is, the trick is to stop it dead in its tracks at the viral replication phase. It's like Tamiflu for the flu, right? Or early treatment for sepsis. It only works if you get in there early.
Right.
And the book claims many COVID protocols are only really effective in those first, say, 4 to 7 days.
So if early action is so obvious, medically speaking, why wasn't it the priority? That leads into Dr. Peter McCullough's 4 pillars idea, doesn't it?
It does. And the book argues that Pillar 1, the early treatment pillar, wasn't just ignored, it was actively undermined. Deliberately. And that this decision kind of set the stage for everything else.
Okay, Pillar 1, early home or outpatient treatment, presented as the main solution, but ignored or suppressed. And a big part of that suppression narrative in the book involves the, quote, attack on hydroxychloroquine, HCQ.
Exactly.
But,
HCQ, which the book reminds us isn't new. It's been FDA approved for 65 years. Used billions of times worldwide for malaria, lupus.
And it's cheap. It's generic.
Right. But the author argues that because President Trump advocated for it, it became politicized. And that led to what the book calls an assassination attempt on its reputation.
And it talks about those two big studies, right? The ones in the Lancet and the New England Journal of Medicine.
Yeah, those negative studies that caused a huge stir. The book notes they were retracted pretty quickly, calling them bogus at best and possibly intentionally fraudulent.
Wow.
But the damage was done, the author argues. Global bans, trial suspended. And from that point, the book claims the NIH and FDA basically set in legal stone a rejection of Pillar 1. Over 40 state medical boards apparently prohibited doctors from prescribing HCQ for COVID.
And the human cost. The book quotes Dr. Harvey Rich claiming essentially that hundreds of thousands of U.S. deaths could have been prevented if the FDA hadn't blocked widespread HCQ use. He puts the responsibility squarely on the FDA.
It's a heavy accusation, and it ties into that Norman Doidge quote in the book about medications and vaccines competing to save the world and for the billions of dollars that will go along with that.
The financial angle. Okay, so let's look at the positive case the book makes for HCQ. First, safety.
Yeah, the book strongly asserts it's safe based on decades of use. Dr. Risch is quoted again saying it's exceedingly safe, used for ages without needing routine EKGs, given to all sorts of people, adults, kids, pregnant women. It cites studies showing really low rates of cardiac issues, like 47 per 100,000, and deaths around 9 per 100,000. The only exceptions mentioned are studies using extremely high doses, which the book dismisses as, flawed designs.
Okay, safety asserted. What about efficacy? How well does it work, according to the book?
It starts with early observations, like Chinese doctors in Wuhan noticing lupus patients already on HCQ weren't getting COVID.
Interesting.
Then Dr. Didier Raoult in France, who combined HCQ with azithromycin. The book claims he saw a 0.5% mortality rate in elderly patients, way lower than the 15% plus elsewhere in France at the time. His study of over 1,000 patients reportedly found a 91.7% good clinical outcome.
Okay. Any other studies mentioned?
Oh, yeah. Dr. Risch's Senate testimony is referenced, summarizing studies from places like Sao Paulo, Marseille, Saudi Arabia, all apparently showing 50% or more reduction in hospitalization or death for high-risk outpatients.
50% or more. That's significant.
And the Saudi study specifically mentioned a 5-fold reduction in death when HCQ was combined with zinc. For hospitalized patients, there's mention of a Chinese study showing much lower death rates in the HCQ group, and NYU hospitals finding that an HCQ cocktail with zinc nearly halved intubation and mortality. Henry Ford's study apparently showed 13% mortality with HCQ versus 26.4% untreated.
And the meta-analyses. Sometimes those give a broader picture.
The book highlights those too. Websites like C19study.com apparently showed a median 64% reduction in negative outcomes, with early treatment studies hitting 100% effectiveness. Another site, hdqmeta.com, estimated a 65% reduction and calculated this incredibly tiny probability, 1 in 36 trillion, that an ineffective drug could produce such results by chance.
Wow, 1 in 36 trillion. Those are striking numbers presented by the author. What about doctors actually using it on the ground?
The book emphasizes the clinical experience of these so-called frontline doctors. Dr. Vladimir Zelenko is a prominent example. He claims he treated over 3,000 high-risk patients with his triple cocktail HCQ zinc antibiotic within 4 days of symptoms.
And his results?
He reported a 0% fatality rate. 0. He argues it provides cure and immunity and believes his protocol could have saved over 200,000 lives.
Cure and immunity. That's a very strong claim. Are there others reporting similar things?
Yes. The book mentions Dr. Brian Tyson and Dr. George Fareed in California. They reportedly treated over 2,000 patients with an HCQ cocktail, resulting in just 1 hospitalization and 0 deaths.
Incredible numbers, if accurate.
And others, too. Dr. Anthony Cardillo seeing patients symptom-free in 8-12 hours. Dr. Mohammed Alam reporting 81% recovery in nursing homes. Dr. Stephen Smith, 0 intubations for patients on his protocol. Even a 92-year-old professor, Dr. Ananda Prasad, apparently cured himself using HCQ and zinc.
It paints a picture of widespread success among certain doctors. Does the book mention prevention, too? Prophylactic use?
It does. It suggests things like quercetin, zinc, vitamin D as a sensible preventative mix, and HCQ itself for prevention, citing an India study that apparently showed an 87% lower infection risk for healthcare workers taking it.
Okay, so that's a deep dive into the HCQ argument. The book then moves on to another drug, right? Ivermectin.
Yes, ivermectin or IVM. The author calls it a miracle drug. It's actually a Nobel Prize winner, used billions of times for parasites, but it also has antibiotic and antiviral properties.
Miracle drug. Strong words again.
Yeah, attributed to Dr. Pierre Corey in the book, who argued it must be implemented now. The logic presented is that since it worked against other RNA viruses, it should work against COVID-19 too.
And the evidence cited.
Studies from Argentina, none sick in 800 IVM recipients versus 58% in controls. Peru reportedly saw 80–90% death reductions in states using it. A Florida hospital study apparently showed 15% mortality in the IVM group versus 25.2% in the control group.
So similar reported success rates as with HCQ.
Pretty much, yeah. The author notes IVM even started replacing HCQ in some protocols, partly because of what the book calls the media-driven hysteria around HCQ.
And meta-analyses for IVM.
Also cited, C19study.com, 33 studies, 88% median improvement for early use. C19ivermectin.com, 34 studies, 86% median improvement.
Okay. And are there other treatments mentioned briefly?
Just briefly, yes. Favipiravir, a broad-spectrum antiviral used in many other countries, and budesonide, an inhaled steroid. The book also points readers towards resources like America's Frontline Doctors, or AAPS, for finding doctors willing to prescribe these kinds of early treatments.
Got it. So that's Pillar 1, early treatment presented as effective but deliberately suppressed. Now, Pillar 2, contagion control. Masks, distancing, lockdowns.
Right, and the book frames this as the big distraction. It doesn't mince words, calling these measures sheer nonsense and not based on reliable science.
Sheer nonsense. Okay. Any specific examples?
It points to that 2020 Danish mask study, which found few statistical differences in infection rates between mask wearers and non-mask wearers. The book also notes the study allegedly struggled to get published due to bias.
And lockdowns, the criticism there is pretty stark too, isn't it?
Extremely. The book cites UNICEF and TOEU warnings about devastating effects, a shadow pandemic of violence, making poor people poorer. It highlights the Great Barrington Declaration, signed by hundreds of thousands, according to the book, calling for focused protection for the vulnerable and letting everyone else resume normal life.
So the book details the negative consequences. Economic ruin, mental health issues, small business closures, educational harm to kids.
Exactly, and it points out the apparent hypocrisy of officials breaking their own rules and makes the crucial claim that none of these contagion controls were based on rigorous randomized controlled trials, or RCTs.
Okay. Pillar 3, hospital treatment. What's the take there?
It acknowledges the hard work of hospital staff, definitely, but it notes that a significant portion of deaths, maybe 25% by its count, still happened in hospitals.
It also raises the possibility that fears about hospital capacity shortages were perhaps used to frighten the public. And it mentions financial incentives, like that 20% Medicare bonus for COVID patients, suggesting it might have skewed things.
Right, potentially creating perverse incentives. Okay, that brings us to Pillar 4, vaccines. How does the book position vaccines in this framework?
As a major distraction and a direct competitor to Pillar 1, the early treatments, the author raises concerns about the speed of the trials and approvals.
And points to statements from officials.
Yeah, like Dr. Fauci suggesting people still needed to wear masks and take precautions even after vaccination, which the author implies undermined confidence or created confusion about vaccine efficacy.
What about safety concerns around the vaccines themselves, as presented in the book?
Those are definitely highlighted. It cites an FDA document from October 2020 that apparently listed 22 potential adverse outcomes, including serious ones like death, stroke, autoimmune disease.
22 potential outcomes listed by the FDA itself. According to the book, yes. It also brings up a controversy about some vaccines using a specific component, an AID5 vector, that might increase HIV susceptibility. A concern the book claims Dr. Fauci himself had raised years earlier regarding potential HIV vaccines.
Interesting. And effectiveness.
The book emphasizes that reinfection is a real possibility, especially with new variants, questioning the long-term protective strategy of vaccines alone. And perhaps most significantly, it points to the liability protection granted by Congress.
Ah, yes, the PRP Act coverage.
Exactly. Shielding companies from lawsuits over injuries from COVID countermeasures, vaccines, drugs, devices. The book notes this prevents people from using the usual National Vaccine Injury Compensation Program.
So pulling this together, who or what does the book identify as the main forces behind this alleged blunder?
It really zeroes in on federal agencies and medical societies, accuses them of a massive national strategy to hold back support for Pillar 1 treatments, claims over 30 American medical societies basically just followed the NIH, FDA, CDC line and deliberately withheld support.
And the data itself comes under scrutiny, right? How reliable was the information we were getting?
The book argues not very reliable at all. It cites Stanford experts like John Ioannidis and Steve Goodman, who apparently called the COVID data utterly unreliable. Things like limited testing, missed infections, selection bias, making the numbers meaningless. A mix of more testing and actual spread.
And the PCR test specifically.
They get heavily criticized. The author claims high cycle counts, like 40 cycles, were generating false positives by picking up tiny fragments, not necessarily live virus or indicating contagiousness. Dr. Mike Yedin, formerly of Pfizer, is quoted arguing these false positives were used to essentially manufacture a second wave.
Wow. And death counts too.
Accused of manipulation, called ludicrous, partly due to those financial incentives for hospitals and the practice of counting deaths with COVID, even suicides or accidents if the person tested positive as deaths from COVID. The book mentions a Johns Hopkins study questioning this over-exaggeration.
This inevitably leads to the central figure in the book's critique, Dr. Anthony Fauci.
Yes, and the book is, well, incredibly critical. It portrays him as the main culprit, the king of virus medicine, even a tyrant and narcissist who terrorizes the public. We have to stress these are the author's characterizations, backed by the arguments presented in the book.
Extremely strong language. What specific actions does the book focus on to justify this view of Fauci?
It directly blames his views and actions for hundreds of thousands of deaths, stating he has blood on his hands. Specifically, condemning HCQ, getting the NIH to prevent home treatment protocols, ignoring the evidence presented for HCQ and IVM.
And his promotion of remdesivir.
That's a major point of criticism. This expensive drug, $3,120 a course, managed by Fauci's group, the book states flatly it had no effect on overall COVID patient mortality.
No effect on mortality.
According to the book. It claims the trial protocol was cleverly changed midstream to measure hospital stay length instead of death, a much weaker outcome. Yet Fauci declared it the standard of care, despite the cost, lack of death benefit, and potential side effects like liver and kidney issues reported in the book.
So the book contrasts his alleged stance on remdesivir with his stance on HCQ needing rigorous proof.
Exactly. It accuses Fauci of hypocrisy, or worse, lying to the public. He demanded RCTs for HCQ, but the book points to the 21st Century Cures Act of 2016, which specifically allows for real-world evidence data outside traditional trials to be used for drug approvals.
So the law already allowed for other forms of evidence.
That's the argument. The book highlights that many common drugs, like insulin or tetracycline, never had RCTs in the modern sense. It concludes Fauci used science to deceive and misinform by insisting only on RCTs for HCQ.
Are there other alleged contradictions mentioned?
Yes. The book claims he warned Trump privately in January 2020, but told the public it wasn't a major threat. Praised New York's handling despite its high death toll. Allegedly stayed silent on potential spread from large protests the author deems leftist, while criticizing smaller White House events. Advocated for a national mask mandate, which the book says exceeded federal power.
And his influence.
Yeah.
Beyond recommendations.
The book claims he controlled vaccine approvals via his agency, selecting the Data Safety Monitoring Board for Operation Warp Speed. And it alleges financial conflicts, close relationships with Big Pharma, ties to the Gates Foundation through a vaccine coalition. The motive implied, blocking cheap generics like HCQ and IVM to protect billions, even trillions, in profits for vaccines and expensive drugs.
So the book concludes the big pandemic blunder was intentional and criminal. What does it say about the human cost, the estimated avoidable deaths?
It compiles estimates from various figures it champions. Dr. Simone Gold, 70,000, 100,000 excess American lives lost. Dr. Risch, many or most of the 220,000 deaths could have been prevented. Dr. Zelenko, over 200,000 lives, potentially a 70–80% reduction in deaths. Senator Ron Johnson is quoted saying hundreds of thousands of lives have been lost.
And part of this tragedy, the book argues, stems from the political climate.
Yes, what it called the hydroxy effect, this hysterical disavowal of anything Trump has endorsed. The author finds it morally repugnant and a disgrace that the public health system didn't use methods. The book claims were proven to cut deaths by 70–80%.
How does the media fit into this final picture, according to the author?
It cites a November 2020 NBER analysis finding 91% of major U.S. media coverage on COVID was negative in tone, much more so than the scientific journals or foreign media. The book attributes this negativity largely to the media following Fauci's lead.
So the final message from the book is quite direct.
Extremely. It essentially encourages you, the listener, to disbelieve what Fauci says, view him as corrupt, and instead trust the frontline doctors who, in the author's narrative, risk their careers to speak out against official directives.
Okay, so this deep dive has explored a really compelling and, as you said, highly critical argument from the book Pandemic Blunder. It fundamentally challenges the mainstream narrative of the pandemic response. The author contends it wasn't just missteps, but a deliberate suppression of early effective treatments driven by complex political and financial forces.
Mm.
And the claimed result: catastrophic human and societal costs from his perspective.
Right. And this perspective suggests that crucial, potentially life-saving information was actively kept from the public, according to the author's viewpoint. So the provocative thought for you listening is, what does hearing this viewpoint mean for your own approach to health information? How do you evaluate authority when such deeply divergent views exist on something as huge as a global health crisis?
Yeah, how will you approach official statements, media reports about public health moving forward, knowing these other perspectives are out there? Something to think about.